Ms. Ocon. I'm a physical therapist. It's good to see a lot of familiar faces out here. Glad y'all are getting started on another successful season and on the journey all the way to the Chevron and Aramco in January. So, like she said, I am a physical therapist, but usually when I do seminars, I try not to talk a whole lot about injuries and what we do on the PT side, because I know there's going to be other PTs and physicians that are going to do a great job of discussing some of the running injuries, and a lot of those things are very common and they're things that you've seen and heard before. So I usually take a different track to try to weave in how those things are affected by, how those injuries may be affected by other factors besides just the injury and the side of the injury that it's at. Okay, so welcome to the talk. 5 strategies to consider for to perform better and have a successful season. So the first strategy that we want to talk about is sleep. So we're talking sleep health. First strategy is to sleep better. So that's consider that sleep fitness, sleep health, and it's all the factors that go into how well you sleep. Question for the audience. I told you to rate your level of sleep on a scale from 0 to 10. 10 is you sleep amazing. 0, you can't sleep at all. By a show of hands, how many people would rate their sleep between an 8 and a 10? It's not very many. Okay, and how many people would rate their sleep a number between 5 or below? Wow. So a lot bigger group that are the 5 or below. Are you guys aware of any particular factors that affect your sleep?
Kids.
You know, anxiety. Anybody else have anything? Hormones.
Temperature.
Injuries.
Snoring.
Injuries.
Snoring.
This is a busy life.
Alcohol.
Absolutely. So,
Drink more.
A lot of those, all those are reasons that we commonly see people have issues with their sleep. Sleep has a very large impact in your performance and your ability to prevent injuries down the line. So what you don't realize is a lot of the repair processes that your body undergoes to repair muscle, repair tissue, they happen while you sleep. So if you're not sleeping well, even if you're doing everything else the right way, there's still a chance that you're going to suffer injuries, and it's going to be harder for you to maintain that pain-free season that you're looking for, and to perform at your maximum ability. So sleep kind of leads into strategy number 2, which is relax better, and we call that brain fitness. And so brain fitness, like you said, anxiety is part of that, depression is part of that, brain fog. So how many people wake up in the morning, you have to like drink multiple cups of coffee because you got like a headache or hard to get going? Show of hands. Wakes up and it's hard to get going. So a lot of that is tied to your lack of sleep. And if you are getting a lot of sleep, but you're having trouble with that part in the morning, it's because your sleep isn't good quality sleep. So if you don't get the good quality sleep when you wake up, it's hard for your brain to process information, especially early in the morning. You use a lot of caffeine to try to get yourself going. That level of caffeine also affects your sleep on the back end because of what it does to your body. It can cause you to have trouble sleeping the next night. So it's a balance between what you need to get going during the day and what you need to be able to sleep well. That leads us to our next strategy. Strategy 3 is to eat better, and that's our, nutritional awareness strategy. How many folks are aware of the optimal amount of carbs, proteins, and fats that they need for their body? Raise your hand if you've done the tests, kind of see what your optimal amounts are. So, proper fueling and the proper amount of carbs or macronutrients in general helps fuel your body to make sure that you are powering yourself to get your maximum performance each time out. So you've got a certain amount of macronutrient needs that you're not meeting. It's going to cause you to sometimes have an issue with waking up in the morning, with powering yourself through your workouts, with recovering from the trauma of increasing your mileage. So, it's a guessing game most of the time when you're trying to figure out what your carb needs are, what your fat needs are, what your protein needs are, and which sources of those are best for you in your particular situation. And so when you're not meeting those thresholds or the minimum amount of calories that you need given your activity level, that's going to cause your body to not process the foods that you eat in the manner to provide energy. So if you're not eating enough or eating the right things, you're going to have trouble fueling and powering yourself to get through a day of work, training, and races, and the like. So getting a handle on what your total caloric needs are on days you run, days you don't run, what your ideal breakdown of carbohydrates, proteins, and fats are, getting that in your diet and making sure that you're eating and fueling yourself for success. That leads us to the 4th strategy, which is move better and movement health. So that obviously encompasses injury, because injury affects how you move, but it also encompasses just your stride and your cadence and all those different things that you work through in coaching. That's all part of movement health. Basically, if you are having to compensate the way that you run because something on one side is bothering you and you're trying to heel strike or land your foot a different way, or you're trying to swing your leg a certain way to avoid a painful part of your limb or your hip or your back, anything that you have to modify to try to get through the race is going to come back to bite you at another time down the road. And so it may not be something that you would consider a pain that you would necessarily see a doctor or a physical therapist for, but it is going to affect your long-term performance and could turn into something that later on down the road that becomes an issue. One rule of thumb to look for when you were talking about movement health is if you've got a pain on one side of your body or the other that's not on the other side, then something is probably going on. Something that's tied to your level of strain and just training volume, it would be both sides. So like if both calves hurt or both thighs hurt or both hips hurt, that's a training thing where you just need to recover, do your strategies, and do all these recovery strategies and get yourself going for the next event. But if you've got one calf or one ankle or one foot, chances are there's something along the chain there that's causing that one issue. And so I've seen some of you guys in the past, and we've identified some of those things, and we've worked with them. You guys have all done a great job recovering and getting back out on the course. But that's typically on the movement side. We can screen before you do get hurt. So if you are noticing some asymmetries, there's a way to screen before it turns into an injury, so we can identify what those are and address them before it turns into something where you have to sit out or, you know, change your race from a full to a half or a half to a 10K, right? If you, whatever you sign up for, the goal is to get yourself to that race in January. So whatever we need to do, we're able to do. That leads us to the fifth strategy, which is to recover better. And you say recover better for the last strategy because the first four strategies are all tied together in the recovery. So if you're sleeping better, your stress is managed, you're eating better, you're moving better, then your recovery is going to be better. And when your recovery is better, you're going to be able to attack all the mileage, all the activities that you need to be able to do without having to worry about sitting out or taking extra breaks or, you know, panicking when we get to November, December, like that you're not going to be able to run the race that you signed up for. And so by implementing all the 5 strategies, that gets you to the point where you do have a successful season and you're performing at your best. Okay. Now, with those 5 strategies, there's a process that we go through to make sure that you get to that end goal. It's very similar to what I do as a PT when we get a new patient that has a new injury. The first step is to assess the current situation. So if you came in for knee pain, we assess why you're having the knee pain. For all these health strategies, we assess, you know, why are you having issues with sleeping? You know, why are you having issues with relaxation? Why are you maybe not having issues with nutrition, but maybe you're just not eating the right things or eating enough of them? We often find people aren't eating enough or eating less than what they need. And so we're identifying, assessing what's going on there, and then getting to the root cause of the issue. And then the next step is to actually address the issues, implement a plan to address the sleep, the stress, the food, and the movement. And then the next step after that is to basically, once everything is implemented, for you to be confident in the plan that you're on, be confident that you're going to make your race, and have all that energy in the morning that you haven't, that's been lacking. Be able to be able to sleep better, not have the aches and pains that you have, be able to think better and process information better, not rely on caffeine and other things to push you through the day. So that's the in conclusion. Conclusion from a injury evaluation is obviously pain-free and being able to return and do everything that you want to do on the medical side. But from a health and wellness lifestyle, it's all comes together to make yourself the best that you can be on race day and keeping yourself there. So with that, I will say we do have some programs that address each one of those factors. The only way that we get to the point where we can implement those programs is to do our testing and evaluation phase first. So testing and evaluation would determine what strategies we use to help synthesize all that information and give you exactly the right plan of action to help yourself get to where you want to be. So with that, open up to questions.